Good evening. My name is Asani Ritchie, an EMT attached to the Negril Fire Station. Today I'm going to do a brief presentation on shock. Now, shock is a result of hypoperfusion. This can be a life-threatening condition where the body's tissues and organs and cells don't receive enough oxygenated blood, right? Leading to widespread organ dysfunction, and it could even lead to death, right? If not treated promptly. Now, in the first stage of shock, the body will try to compensate for the loss of the body fluids. It will try to maintain its homeostasis, meaning it will try to balance the functions of the body, right? There are three main types of shock that we are going to discuss today. We have distributive shock, cardiogenic shock, and hypovolemic shock. Now we are going to discuss distributive shock first. Now, distributive shock is a type of shock characterized by inadequate blood flow and oxygen delivery to the tissues by vasodilation, right? And maldistribution of the blood volume, right? Causes of distributive shock include septic shock, anaphylactic shock, neurogenic shock, and certain medication. Right? How do you treat these? In terms of septic shock, you will need to replace the fluids that you have lost. Anaphylactic shock, it can be treated by using a EpiPen, right, to dilate the blood vessels. Presentation for distributive shock, you will find you will have the patient will have low blood pressure. It will probably have rapid heart rate or even fever, right? Next shock we're going to discuss is cardiogenic shock. Now, cardiogenic shock is a type of shock that is caused by inadequate cardiac function, leading to decrease in cardiac output and also tissue perfusion, right? The cause of this is you can have heart failure or myocardial infarction. Presentation, you will find that the patient might have low blood pressure, weak irregular pulse, chest pain, cool and clammy skin, also cyanosis. Treatment for this shock would include placing the patient in a position of comfort, administering oxygen, assist in ventilation if needed, and rapid transportation to the nearest hospital facility, right? Next we are going to discuss the hypovolemic shock. Now, in hypovolemic shock, is the inadequate blood volume, which is caused by loss of blood or fluids, right? Um, this can be caused by hemorrhage. Maybe you can have a major burn, um, major bleeding, right? Now the presentation for this, you will find you'll have cool, clammy skin, um, low blood pressure. You'll have rapid, weak pulse, and even cyanosis. The treatment for this type of shock, you will secure the airway, assist with the ventilation, um, give the oxygen. If there is any major bleeding, you're going to control the major bleeding. You're going to elevate the extremities, and keep the patient warm, and transport promptly to the nearest facility. That's it for me.